Hello everybody, welcome to day 3, aortic valve options and aortic valve stenosis. Today we're going to talk about TAVI. TAVI is short for transcatheter aortic valve implantation. This is a way by which we can insert a collapsed tissue valve through a catheter placed usually in the groin, although we can place it through a cut in the chest or arteries higher up in the body. Essentially, this is really useful in those patients where surgery might be too risky. If you're elderly and more frail, you have other problems, say perhaps with your lungs or your kidneys, then TAVI is a way by which we can continue to offer treatment where treatment with surgery may not have been possible. Now, the beauty of TAVI is that we don't always have to give you an anaesthetic. The beauty of TAVI is we don't need any cuts, and the beauty of TAVI is we don't need to use a heart-lung machine. The drawbacks of TAVI are that we still do not understand how long the valve will last for, and currently we are of the belief that current tissue valves will last longer than TAVI valves. Certainly, mechanical valves will last a lifetime, and TAVI valves we do not expect to do so. The other problem with TAVI valves is that, can you imagine that when we take your aortic valve here through surgery, we cut it out and we put a new valve in. We stitch it in or we place a sutureless valve that is self-inserting. The beauty of that is that, of course, we don't force your calcium of the valve into the soft tissues around where your valve sits. With TAVI, it's different. We insert the TAVI valve inside the calcified valve and we expand that valve, or it expands itself, and all this calcified tissue can injure the softer tissues around the edges. This means that there is a higher risk of pacemaker requirement with TAVI because the pacemaker system that regulates the way your heart beats and the speed with which your heart beats gets damaged. And the risk here is about 15 to 25%. That's really high. And the only way to treat you is to then put a metal box underneath the clavicle with wires into the heart. We know when we put in pacemakers, we reduce the length of life of a patient. So it's not an ideal thing to do. With surgery, just as an example, the risk of pacemaker is only 1 to 3%, so much lower. Now, the other drawback of TAVI is what we call paravalvular leak. You imagine your calcified valve, you put in a valve like this through TAVI, there's going to be irregularities around your TAVI valve where a seal hasn't occurred. And these paravalvular leak edges can be really important. If they're moderate or severe, that will also reduce your length of life. With surgery, the risk of paravalvular leak is again very low, perhaps 1 to 3%. And that's because we've cut the old valve out and either sewn a new one in or we've put in one of these self-inserting sutureless valves. So for now, the general consensus is that surgery is the gold standard. It'll give you the best short-term and long-term result. You have the options of tissue valves and mechanical valves, but TAVI is really useful in those situations where surgery might be too risky. One other option for TAVI is to use it as valve in valve. Now, what does that mean? What that means is that, say for example, you've had previous heart operation where we inserted a tissue valve and that tissue valve has failed, then putting a TAVI valve inside the tissue valve might be a useful option. Now, we can do it, but we still do not know what the long-term results of doing something like that are going to be. The other advantage of TAVI might be, say you've had another type of heart surgery, you've had, say, coronary artery bypass grafting, and now you've developed aortic valve stenosis. TAVI can be really useful because it means we don't have to reopen the breastbone if that's how you had your surgery. I think generally on the whole, at the Keyhole Heart Clinic, we would always wish to assess a patient with severe aortic stenosis in terms of their suitability for keyhole heart surgery. Particularly the one where we can go in through the ribs on the right hand side because there's no broken bone. We know that people will heal very quickly from this, and putting in a new valve, particularly for example a sutureless valve, is really easy using this technique. If patients we believe are not suitable for that, then TAVI is a good alternative.